Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. First, I would like to thank Allison Bell from the Think Advisor for reporting on the HAFA Live last week, in which we called out the GAO and Senator Casey on the crazy, ludicrous audit that they presented about agents and brokers. They called 31 people. They had 8 bad actors that steered them to a short-term medical plan, and then decided to victimize the agent and broker industry. We need to please read Allison's article, because I think you'll find it very, very telling. She did a wonderful job. Reach out to the GAO. They need to hear about the fact that really, all the agents and brokers in the United States, and you base your audit and send it out on 8 people, and then reach out to Senator Casey and say, you're calling for jail time on an audit that was based on 8 people? The Senate Democrats requested this audit. So imagine the people that this audit went to that now think we're all bad because of 8 people. We need to reach out to our senators, the GAO, Senator Cassidy, call Senator Cassidy, I love him, Senator Casey, and let them know. I will let you know on every occasion, I'd say 99.9% of every time I went to the Hill, we tried to meet with Senator Casey. I have not been able to meet with him or his staff. So he hasn't met the HAFA CEO, nor has he met any HAFA agents. But maybe it's time that you reached out and introduced yourself. As we prepare for open enrollment, we find that United Healthcare is acting badly once again. Some of you will remember several years ago, we enrolled everybody during open enrollment, and then United Healthcare said, surprise, we're not going to pay you. That still gives me a stomach ache. But anyway, now they're saying, at least before open enrollment, yes, we're going to sell in several states, but no, just because we made lots and lots of money doesn't mean that you deserve to be paid, nor does the consumer deserve the option to choose an agent. So even though United Healthcare made a lot of money, they're not going to pay commissions in Maryland and Virginia that we know right now. We're not sure of other states, so I'm kind of waiting for you to tell me what states they might have reached out and said they're not going to pay. But this is absolutely unfair. We also got word that Oscar in New York has decided agents and brokers, hey, you don't deserve to get paid. You don't work hard enough. We've decided we've made a lot of money. We want to make some more money. They're not paying. They don't, and they also don't think that consumers deserve the option to have an agent. I've reached to CMS. While CMS cannot do anything about this, I think it's important that they know. And the reason I think it's important that they know is the last face-to-face meeting I went to at CMS in Washington, D.C., I stood up and asked the insurance companies, are you going to continue to pay us? Are you going to stop paying us? Face-to-face question. A lot of times when I raise my hand, people don't want to call on me, but that's why we started HAFA, and that's why I represent you. But the insurance companies said, yes, we're going to pay you. Don't worry about it. Well, somebody lied, and CMS needed to know that. Please, again, if you hear anything about United Healthcare, Oscar, let me know, and shame on you. We work hard. The minuscule amount of money that you are paying us isn't a drop in the bucket that affects your bottom line. President Trump announced in his healthcare initiative that he's going to include something on balanced billing that now we call surprise billing. Surprise billing is touted as going to save between $12 billion and $38 billion in insurance premiums. That's a lot of money. That's huge. That could affect our consumers, our clients. The ACA has given states the option, ACA gave states the option of opening a co-op in the beginning. Several states opened co-ops. There's only 3 left. You might have read that the court ruled that risk corridor money is going to come back to the insurance companies. I've done investigation, and they're also going to come back to the co-op. So I had an agent that reached out and said, look, Louisiana co-op owes me a lot of money. I read about this risk corridor. Will we get any money? I talked to Commissioner Jim Donelon that connected me with one of his attorneys, and we had a conversation last week. Yes, indeed, co-ops will get risk corridor money. The problem in Louisiana, and I have to check for your state specific, so if this is happening to you in a state, you need to let me know. In Louisiana, the federal government, the co-op owes federal government a lot of money. So the risk corridor gives the co-op federal, get federal dollars, the co-op owes federal dollars. Well, the feds are number one in who's supposed to get paid, and then we're probably third or fourth down the line behind providers and people like that. So I asked, is there any possibility that we're going to be paid, and basically they said they hope that that the attorney that's handling it, Billy Bostick, is going to ask the federal government if they can take care of the low-hanging fruit, which would be agents and brokers, because what they owe us is nothing in comparison to what they owe others. So they promised to keep me in the know, and I promised our agents that I will continue to watch and see what's going on. But for those in other states, I need to know if you were affected so I can reach out to your Department of Insurance and find out how that's going to be handled in your specific state. Basically I'm keeping my eyes on the ball, and will continue to fight for you, your commissions, and our livelihood. Trump is offering a limited drug import plan. He finalized his plan to allow states to import drugs from Canada. If you were on the Education Thursday, you heard from Sharks, who talked about how they, for their individual clients and group clients, that they import drugs from Canada. And I had a specific drug example that in the United States cost $1,500, in Canada cost $500. So that gives you an idea of 1/3 of the cost. So I think it's going to be huge, and I think that states need to get involved. The states can start now states can set up their own system, and they can start, requesting from the FDA, submitting their proposals, getting ready. Secretary Azar said that the program will result in a significant reduction in covered products. And what is next with this? Of course, we live in a sue society. It will be court, probably litigation on the procedure and the substance of the rule. And that is according to a law professor at Washington University. So good news, but of course it will end up in the courts, and hopefully it'll end up being a good thing. This Thursday in a couple of days, 2 o'clock Central Standard Time, Janelle Stanton, attorney at law, is going to present remote workforce policies and compliance. As more of us work from home, as our agencies are working from home, as a lot of our clients have decided we're going to work from home and never have a brick and mortar, you need to understand how to comply and what the laws are. Agents and brokers do more than they've ever done before for less money. This is important, information that you can present to your clients to help them when they have some questions about how to comply and what laws apply to those employees that are working from home. It is CE is approved in Louisiana, Georgia, and Texas. HAFA has decided to use continuing education as a marketing tool. So please send out the continuing education to all of your friends and colleagues, because they are eligible for the free continuing education. And that way they can meet HAFA and possibly join on Thursday the 8th at 2 p.m. Central Standard Time. Not a CE class, but very important Education Thursday, how analytics can save your clients money and how it can save your clients, by Rick Shield. So this is important. If you sell self-funded plans, you need to understand how this analytics program, which they are one of our sponsors, can help you save dollars. On the 22nd, we're excited to have Angie Sura, Vice President of Compliance for Navigate HCR, do a compliance communications. It's hosted by New Synergy, and it's approved in Louisiana. I filed for CE, Connecticut, Georgia, Nevada, and Texas. Angie did this CE on our CE cruise, and it was really one of the best CEs I've seen in a very long time, so I'm very excited. She's going to come back and do that for us again. And on the 29th, our last CE for the year because of open enrollments, ERISA Rules and Regulations, again by Angie, Vice President Compliance, Navigate HCR, and hosted by New Synergy, approved by Louisiana, applied Connecticut, Georgia, Nevada, Texas. And I don't foresee a problem with having approval from those states. I'd like to welcome a new member, Rebecca Yates, ARC Insurance Solutions from Utah. So we need a strong agent in Utah, and we are excited to have Rebecca. She serves on many of the CMS agents and broker trade groups. So she comes with a wealth of information. I'm honored and proud to have her as a new member. Regardless of the politics, excited President Trump nominated a Louisiana girl to Supreme Court Justice, Amy Barrett. So we'll see what happens with that. That's going to be very interesting, exciting, and I just said I hope that she keeps her children far away from the TV because of the mudslinging will begin. Change in Summit. Due to COVID, we're not going to have it in March. We're going to have it August 26th and 27th. And at our last board meeting, there was some questions about possibly moving it somewhere else. So we're going to have a contest. Should we decide to host it somewhere else, if you'll pick, you got to give me a hotel in a city, and submit it. If your hotel and city is chosen, then you'll receive free registration. So put your thinking cap on, something that would be affordable for everyone to go to, that HAFA could afford, and it'd be something fun and different for our members. So don't forget about that. I think that's the end of our presentation. I think that's enough. Until next Monday, honored and proud to represent the HAFA Freedom Fighters. Don't put your head in the sand. Fight like there's no tomorrow, and call me if I can be of any service.